guys, I'm Samantha and I am here to talk about a really important topic that plays a big role in my life. And with September being the awareness month for it, I thought it would be a good thing to talk about. And I had some people mention in my comments in past videos that they would be interested in hearing more about this topic. You have to excuse the way that I look. I am going to be bulk filming stuff. I am dealing with a migraine as well and trying to record this in between reading sessions. So we will see how well this goes. And if the lighting is really weird, I can't be bothered to turn up and get a light because my head's already hurting from this light. But the topic for today's video is polycystic ovarian syndrome, otherwise known as PCOS. It is a condition in which the ovaries produce an abnormal amount of androgens, the male sex hormones that is usually present in women in small amounts. The name polycystic ovarian syndrome describes the numerous small cysts, which is fluid-filled sacs that usually form on the ovaries. However, some women with this disorder does not have cysts, while some women without the disorder do develop cysts. I don't really, as far as I know, I don't develop cysts, but I do have endometriosis along with it, so that is one of the issues that I am dealing with my PCOS. The symptoms of PCOS may include missed periods, irregular periods, or very light periods, ovaries that are large or have many cysts, excess body hair including chest, stomach, and back, which is something that I constantly have an issue with on my face, weight gain, especially around the belly. I also show this and I get very unnecessary questions from lots of people asking when I am due because of the way that I carry my weight. Acne and oily skin, which is a problem I'm having currently. Male pattern baldness or thinning of hair. I shed like a cat, so another thing that I get. Infertility. We've been struggling with infertility since my diagnosis, maybe about 7 years now. Honestly, I'm starting to lose count. Small pieces of excess skin on neck or armpits, or skin tags. I don't really have that problem. Dark or thick skin patches on the back of the neck, and the armpits or under the breast. Treatments usually include just birth control to regulate the cycles, or a medication called metformin to prevent diabetes. There are some statins to control high cholesterol, hormones to increase fertility, and procedures to remove excess hair. I currently am not on birth control because since me and Jordan have been trying to have a baby for years now, we are not preventing that, but I am on metformin because I am insulin resistant, and that is the main cause of my weight gain and the reason why I have such a hard time losing weight. Treatment for PCOS depends on a number of factors. These may include your age, how severe your symptoms are, and your overall health. The type of treatment may also depend on whether you want to become pregnant in the future. A lot of the times they say if you want to become pregnant, a change of diet and activity, a healthy diet and being more physically active can help you lose weight and reduce your symptoms. And it can also help your body use insulin more efficiently, lower blood glucose levels, and may help you ovulate. And then there are medications that would cause ovulation to help the ovaries release eggs normally. These medications do have certain risk factors. They can increase the chance for multiple births, like twins or more, and they can cause ovarian hyperstimulation. This is when ovaries release too many hormones, which can cause symptoms as abdominal bleeding and pelvic pain. I was put through rounds of fertility medications the first couple years of being trying to conceive, and I was on such a high dose at the time that it was making me super sick and it was affecting my ability to go to work. So if you do not plan on becoming pregnant, your treatment may just be including birth control pills, diabetes medications, a change of diet and activity, and medications to treat other symptoms like reducing hair growth and acne. Most of the complications when it comes to PCOS, it can develop to certain high health problems like type 2 diabetes, high blood pressure, problems with heart and blood vessels, and uterine cancer, and also with the issue of having struggle with infertility. The causes of PCOS isn't known, but a lot of factors do play a role, like insulin resistance, like I have. Insulin is a hormone that the pancreas makes. It allows cells to use sugar, your body's primary energy supply. If cells become resistant to the action of insulin, then the blood sugars levels can go up, which will cause your body to make more insulin to try to bring down the blood sugar levels. Too much insulin might cause your body to make too much of the male hormone androgen, and you can have trouble with ovulation that way, and the process of where eggs are released in the ovary. That is my main issue, is just the insulin resistance, which is why I'm on the metformin. Also cause low-grade inflammation. White blood cells can make substances in response to an infection or injury. Research has shown that people with a type of long-term or low-grade inflammation, it will lead to polycystic ovaries to produce androgens, and this can lead to heart and blood vessel problems. And it could be hereditary. Research suggests that certain links have been linked to family history and may play a role in developing the condition. And then going back to the excess androgen levels, having too much of it will interfere with the ovulation, as I said, and it can also result in the excess like body hair and acne. And it also has links to other health problems like diabetes, high blood pressure, an unhealthy cholesterol, sleep apnea, depression and anxiety, and endometrial cancer. Researchers don't know if it causes any other problems, if these problems are caused by PCOS, or if there's a condition that causes PCOS and other health problems. And I'm getting all that my information, I think, mostly from when I researched it, I got most of it from the Mayo Clinic's website, so that's where my resources is coming from. And just based on my current experience, I'm also dealing with a lot of the inflammation and have been referred to see a rheumatologist because I am showing markers of inflammation of rheumatoid arthritis, which is probably a cause from the endometriosis and PCOS because of having the high inflammation. It sucks. I have, like I've said, been dealing with this for years, possibly longer, even before I was even aware of it, because I was on birth control from 15 to 18, and then I was on birth control for a few years, so a lot of my symptoms were hidden until we had decided to start trying for a baby, and that was when all the symptoms had started to show up. A lot of my issues are really connected together just based on this. I'm not diabetic, but I do have that insulin resistance, so I gotta be careful with that and make sure I take my medications. I have endometriosis, which is where scar tissue forms on the outside of the uterus, and it can cause a bunch of different issues, which I'm gonna be having surgery at the by the time you're watching this, I would have had surgery in April to remove endometriosis, and that usually comes back every few years, so it's a constant struggle. And I already deal with depression and anxiety. I've always been an anxious person. It's just I have a lot of health issues just in general, which you would know about on this channel because I'm trying to be more open and honest with like my struggles with my health. So if you have any like other questions, I can try to answer them as best as I can. This is just something that I'm just going to be having to deal with for the rest of my life. There's not much I can do other than just try to stay on top of the symptoms and take as much like supplements and stuff to kind of relieve the symptoms. I know currently, not including the medications that I have been prescribed, I'm on at least six different supplements to kind of help with the symptoms that I'm dealing with. And yeah, I really didn't want to be in my 20s and having to take about the same amount of medications as my parents are taking, but that's just kind of the reality of it, unfortunately, and I'm just dealing with it as the best as I can. As I mentioned, if you guys have any questions, leave them down below. Like this video if you like this content, and hit subscribe to keep up to date with any new videos I come out with in the future. And until next time, you guys, bye.